Hello everyone, how are you guys doing? Welcome again at Well Through Health with Dr. Giselle, and my passion is helping successful, high achieving women restore their health through lifestyle and hormonal balance. So, and yes, I'm a GP, but I'm not your typical GP. I'm very passionate about lifestyle and integrative medicine, and I'm a yoga teacher. So I combine all of this mental health, overall physical health, spiritual health to provide women the necessary tools to restore their health, so that they can continue their path on achieving their goals and living their purpose, right? So yes, and then now welcome again. Today we are talking about what the hell are hormonal types. With my last videos, I got a lot of feedback on what are hormonal types. It's the first time I'm hearing about hormonal types. I knew about body types, but what is the difference, and why should I care about my hormonal types? So today we are talking about what are hormonal types and why you should care about your hormonal type, if you have any, right? So first, let's talk about the 4 hormonal types. I will link a video. I will link a video in the description box where I go for more in details about the hormonal types. For the sake of time, I will only recap the 4 hormonal types. If you want to know more, watch the video in the description box next. That will give you a more detailed description about the different hormonal types. And yeah, so to recap about the hormonal types, you have 4 hormonal types: the cortisol hormonal type, the insulin hormonal type, the estrogen hormonal type, and the inflammation hormonal types. So what's up with all of these hormonal types, right? So the first one is the cortisol hormonal types. And one of the questions that I got is, how does it correlate with the body type description that has been predominant? It correlates with it in that the cortisol hormonal type is, you also see the stress body type and the adrenal body type. I prefer to use hormonal types because as a GP, as a doctor, I like to go straight to the root cause of it all. And with the description of the body type, there's not much attention to the root cause, which is the hormonal imbalance. So that's why I choose cortisol hormonal type, because it also encompasses more than just the body. It is an overall hormonal type. So the cortisol hormonal type correlates, or you see a lot of times with the cortisol hormonal type, that women are displaying the adrenal body type or the stress body type, which is a body type often described as the apple body type, in which you carry the apple in front of you. You can imagine you have a big old apple and you carry it in front of you. So most of the fat deposition within the cortisol hormonal type is in front of you, is in the belly, in front of you, and it is a lot of visceral fat, we call it, which is the fat deposition around your internal organs, which correlates with a higher incidence and prevalence of diabetes, high blood pressure, metabolic syndrome, and cardiovascular disease. So the root cause of the cortisol hormonal type is already in the name, is the cortisol. So the cortisol is a great hormone. We need cortisol. Actually, some scholars say that without cortisol, we will die, right? So we need cortisol. It is our stress hormone. It is necessary for us to be able to react to stress, which is not something bad. But when cortisol is out of balance, when stress is not in balance with relaxation, when your sympathetic pathway is not in balance with your parasympathetic pathway, and those two pathways correlates with action and relaxation. When stress is not balanced by relaxation, like I said, cortisol will get out of balance. Our adrenal gland is just shooting cortisol day and night, which will cause a constant stress reaction within our body. And that will cause you to, again, gain weight around, and the fat deposition will be around your visceral organs, around your internal organs. You will experience insomnia, having trouble sleeping. You will feel very stressed out, not being able to relax, calm yourself down. Even when you sleep, you will feel after a good night's sleep, you will feel that you are not rested yet. And that is if you even fall asleep. Because of your cortisol level being out of balance, it will counteract your melatonin hormone, which is the hormone that is needed for you to fall asleep. What can you do about your, if you have a cortisol hormonal type? I explained it in much more detail in the other video in the description box, like I said. But one of the most important things that you can do when you are having or experiencing, or you are or you think you have the cortisol hormonal type, is to lower stress, is to practice stress release. And you're gonna have to do it intentionally. Just saying I'm relaxed is not gonna change it. You're gonna have to practice conscious stress release. And how do you do that? Through different mind and body techniques, such as yoga, meditation, mindfulness based stress release, or just daily walks in the park, or in nature, or at the beach somewhere. All of these are very good exercises for to lower stress and to balance cortisol if you're having a cortisol hormonal type. Next hormonal type, the insulin hormonal type. The insulin hormonal type is the body type that they call, correlates with the body type that they call, I think, sugar body type, in which you have the apple figure. If you describe the body of the insulin body type, you are also having the apple shape, but you don't carry the apple in front of you, but you carry the apple inside of you. So you have some of the fat deposition in front of you, but what we see is that the fat deposition is on the side of you. So you have what we call the love handles, right? You lose that hourglass shape. Another characteristic of the insulin body type is feeling hangry, is that you cannot go without eating every 2 hours. So every 2 hours you have to find yourself eating something. So there's a lot of grazing and snacking within the insulin body type, a lot of craving of sugary foods. Every 2 hours you feel like you're getting a little bit dizzy, you're getting a little bit hungry. You can even get mood swings and become angry and hungry. That's where we get the word hangry. And all of that subsides when you eat something sugary. So you go through the day eating something sweet every 2 to 3 hours, which causes your insulin level to surge every 2 to 3 hours. And a higher insulin levels is predisposed by you getting type 2 diabetes later on in life, or early on in life right now. And it also, high insulin levels also correlates, we are seeing it correlating with all types of other diseases, so such as dementia, and even PCOS in women. If you want to know more about the insulin body type, go into the video in the description box. But one of the things that you can do to combat your symptoms, if you suspect that you are the insulin body type, is to practice the 3 and 4 method. The 3 and 4 method, what I explained to my ladies, is that you eat 3 times a day and you make sure that you have 4 hours at least in between every meal. It is a type of intermittent fasting, but I don't like to call it intermittent fasting because that is much more complicated and you need much more guidance to do that. But if you eat 3 meals a day and you make sure that you have 4 hours in between the meals, that is pretty safe for most women to be doing. Yes, the inflammation. No, let's go to the estrogen body type. Next one is the estrogen body type, and the estrogen body type is correlates with the body type of the estrogen body type. Yeah, so the estrogen hormonal type correlates with the estrogen body types. And if you would to describe the body of the estrogen hormonal type, is a pear figure. So you still have that hourglass, but the most of the fat deposition is around your hips, around your buttocks, your upper thighs, and much less around your internal organs, which is on one side something good because it doesn't correlate with cardiovascular disease, high blood pressure, and diabetes. What we also see with the estrogen body type is a lot of fluid retention. You can have a lot of fluids around your legs at the end of the day, that your socks and your shoes don't fit anymore because you have a lot of fluid retention with the estrogen body type. And another things that we see with the estrogen body type is a lot of estrogen dominant symptoms, such as PMS, fibroids, what's the word I'm looking for? Endometriosis, PMDD, migraines, all of those symptoms that correlates with estrogen dominance, we see it within the estrogen hormonal type. One of the things that you can do if you suspect that you're suffering from the estrogen hormonal type is to eat 500 grams of vegetables every day. In the other video, I'm explaining a little bit of why, but it has to do with your liver. Your liver needs the nutrients, the phytonutrients in vegetables, especially cruciferous vegetables, which are broccoli and all of the cabbage family, kale, cauliflower, Brussels sprouts. Those have specific phytonutrients which will help your liver process estrogen so that you can have less symptoms if you are suffering from the estrogen hormonal type. Okay, so 500 grams of vegetables when you're having the estrogen hormonal type. Let's go to the inflammation hormonal type. The inflammation hormonal type correlates a little bit with cortisol, in that cortisol and a lot of other hormones are used to literally put out fires in your body. Your body is literally on fires. It's having all kinds of fires all over your body. How do you see this? A lot of these women are suffering from very weird symptoms, autoimmune diseases such as lupus, Hashimoto, Graves' disease, and psoriasis, rheumatoid arthritis. There's a correlation between the inflammation hormonal type and autoimmune diseases and all types of inflammation. These women are taking a lot of pills to deal with a lot of chronic pains, a lot of non-steroidal anti-inflammatory pills such as ibuprofen and naproxen to just combat body aches and pains and inflammations. One of the things that you can do if you are suspecting that you are having inflammation is to just eat, is to, how do you call it? Lower the amount of inflammatory foods that you take. And 3 foods that you can decrease or minimize that are highly inflammatory are gluten, dairy, and sugar. So if you suspect that you are having the inflammation hormonal type, you can lower your symptoms by eating gluten-free, dairy-free, and sugar-free. Yes, so those are the 4 hormonal types. This was a recap. In the other video, I explained much more about the hormonal types. And the other question is, why should you care about your hormonal type? Why you should care about your hormonal type? Because this is a women thing. All of these symptoms that I'm telling you, PMS, PCOS, a lot of men don't suffer from these symptoms. This is a women issue. And if you are a woman, you should know about these issues, right? Let me grab a sip. This is a nice tea. Yes, so it's a yogi tea. It's delicious, nice. I don't know the name, so all of these issues have a lot to do with us as women, and things like autoimmune diseases are sometimes 3 times more common with women than with men. So a lot of these issues that I'm explaining that correlates with having a hormonal type is a women's health thing. The point is that health for the majority of these last centuries was very men-driven, men-described, and men prescribed, right? That's just how the history went, right? We are seeing some changes in that a lot of health caregivers are understanding that gender-sensitive health care is very important, whether it is physical health care or mental health care. Being gender-sensitive is very important because what applies to men does not apply to women. Something simple like all of the painkillers that you are buying at the drugstore, majority of them has never been tested on female bodies. They haven't even been tested on female animals, if they are tested on animals, right? Because even the industry understands that hormones complicates things. And that's not to say that we women are complicated. We are gorgeous beings, amazing beings that needs understanding. So it's very important for you to know about your hormonal type and about hormones, because it affects you. It affects your health. It affects your mental health, your physical health. It affects how you feel, how you look. It affects symptoms, and it even affects whatever advice you are given. And now I'm coming to the second reason why you should care about your hormonal type, is because a lot of healthcare givers still don't understand hormones, women, and the different hormonal types. And sometimes before you take a medication or before you take an advice, you are going to have to educate them about your hormones and your hormonal types. A lot of times I have found myself explaining to my health caregiver something about my hormonal types and what fits me and what does not fit me. And you might say, well, that is not fair. It might not be fair, but it is what it is, okay? So you might be the only one that can explain to your health caregiver about your hormones and your hormonal type. So that is another reason why you should care about your hormonal type. And the third reason why you should care about your hormonal type is because when you design your lifestyle, like this year, it's the beginning of the year when I'm making this video, everybody's talking about their mood board, their vision board, they have in their resolutions. But before you create all of that, it's important to know your hormonal type and what lifestyle changes, choices fits your hormonal style. If I knew that I was a cortisol hormonal type and that I was very sensitive to cortisol and stress, I would have made different choices when choosing my career as a medical health caregiver. I would have made different choices when trying to keep up with the Joneses and having the expensive car payments and having the house payments and having all of these things that were just stressing me out in trying to keep up with other people, but not giving me the rest and the joy that I needed. So knowing your hormonal type, for example, if you know that you have the inflammatory hormonal type, you may pick a different meal at the restaurant the next time you go with the girls, right? Because you know certain foods will leave you feeling ugh the whole weekend, right? So knowing your hormonal type will help you design the lifestyle that fits you. So there you have it, 3 reasons why you should care about your hormonal type. Again, if you want to know more about hormonal types, click in the video in the description box, and there I will explain more about the hormonal types. It's a longer video, so put on your headphones and just go for a walk while you're listening to the different hormonal types. If you have any questions about your hormonal types, I will put my email in the description box. You can shoot me an email, and I will love to talk to you and answer your questions. And again, thank you for watching this video. Subscribe for more of these amazing videos, and that will help me spread this very important information about hormones and women. And if you suspect that one of your sisters, friends, mother, daughter might be suffering from a hormonal type, send this video to them so that you can help them care about their hormonal type, and so you can help me spread the news. And yes, that's it. Thank you for watching, and I see you guys on the next one. Bye.